In this video, I'm going to share on hallucination in Alzheimer's patients. This is drawn from my experience in taking care of my mother and from what I actually read in forums and private support Facebook groups. I think in the West, in hallucination, when person have hallucination, you would say that maybe that they are reliving past memories, and what they do is that if the hallucination result in very aggressive behavior or uncontrollable behavior, or they have sundowning, then what is normally done is that medication will be prescribed. But from what I read in the forum, sometimes even if you prescribe medication, right, it can only work for a short while and then it does not work after that. So what they will do is that they will actually keep increasing the dosage and increasing the dosage till the patient is more or less like drug or in a daze. And even sometimes that also don't really work, because when the medication wears out, right, then the patient will behave aggressively again. In this video, I'm going to talk about something that maybe you may not be familiar or you may consider as very controversial. But in Asian, in our society, it is not something that, what I'm saying is not something that is considered totally strange or unheard of. My mother have Alzheimer's, and yes, she has hallucination. She would actually report seeing dead relative, means relative that have passed on, and then she would be pointing at something at the ceiling, and then she will act. Her symptoms will behave as though somebody is speaking to her. So beginning now, how for us we will say that if you ask me, I would think that these hallucinations is not imaginary, and that even though it's not 100% of all cases, but in majority of the cases, they are really seeing what they are really seeing. It's just that normally this will happen when their illness is quite advanced. So when that is being the case, right, when already it is quite advanced, they are no longer able to explain or communicate well to us what is happening, then that's normally when the hallucination will get worse. Like my mom cannot really tell me, beginning she could still occasionally when she start having hallucination, she could still tell me what she saw, but eventually she cannot already. One of the thing about Alzheimer's is that when a person have Alzheimer's, their mind start to regress backwards. They start to a lot of things. You see in life, we will tend to build up protection or to protect ourselves. We will tend to build up attitudes and belief, and sometimes we want to protect ourselves from getting hurt. So we may have some kind of coping mechanism, or that is actually that actually obstruct us from the realities, the real thing that is prevent us from seeing things properly. So when a person develop Alzheimer's, right, because they forget, they start forgetting what happened in the past. So these barriers start to fall off one by one. And when the barriers start to fall off, and as their mind regresses to like maybe a 3-year-old, 4-year-old child, then it becomes very innocent. There's no barrier, so they can see. In other words, like what I've actually discussed with a friend of mine who is into spiritual work, I think they start having the third eye. They are able to see things that we cannot see. So it is actually something not surprising, because many children, when they are young, they can also see. They can also see until when they actually grow to be maybe about 7 years old or so. then when they start having preconceived notions, when they start forming attitudes and coping mechanism and way to deal with situation, then that purity, the innocence is blocked off gradually, right? So it also they can't see. But of course, there are people I know who actually have to live with this for the rest of their life, and they actually can see. So this is the part where I feel that they are not purely hallucinating. Of course, there are some that could be really hallucinating, like when it's really a medical condition that they are really reliving old memories, and this is like there's a floodgate being unleashed, and then they start having all these painful memories, and what they're telling you they see is basically a manifestation of the past. It could be the case. Therefore, it is very important, be it spiritual, be it they're really seeing things or not, you have to they have to get professional medical consultation. In the case of my mom, she is actually being, for her Alzheimer, she's treated by a psychiatrist in the hospital where she's seeking treatment. And the psychiatrist will prescribe a medication called neopatin, 25 mg, or is also more popularly known as Seroquel. So this is actually a medication to relax her mind. Even though they can, with hallucination, they can see, it's important that they are on medication, because if they cannot sleep, like my mom was having problem, not able to sleep, and even with Alzheimer, they can also have depression. So if their mind is not relaxed, it makes their condition worse. But then at the same time, what we also would do is, from the case of my mom, is what I really do is, how I know that these symptoms are of spiritual nature is because it gets better with spiritual intervention. So that's why we know that what is happening is of also spiritual cause. But again, I need to emphasize, taking medication is very important. My mom used to be prescribed with a medication that really, the Seroquel, and also another medication that really put her to sleep. Means it knocked her out. Because my mom have insomnia for about 20 years. After she had tonsil cancer 22 years ago, and she had radiotherapy, she had problems sleeping already. So most of the time she get like 2 or 3, she says she will be lucky if she get 4 hours of sleep. So I guess that this is also what compounded to her problem of getting, make her get Alzheimer, because my mom also was already forgetful all along. So compounded with the fact that she couldn't sleep for about 20 years. So it actually triggered her situation. That's why the medication is important. It helps her sleep, it relaxes her. And even though she see or whatever, basically, because you see, when they have hallucination, I can only say for what I'm doing for the case of my mom, as I'm taking care of her, right? When she have the hallucination, it doesn't bother her, because in their mind, right, they do not know what is like. I mean, I know it's very different in the West, but I will share based on what my experience with my mom. Because in their mind, they're no longer able to understand or they form concepts anymore already. So, or convention. So what they see is what they see. It's like, maybe it's just like seeing another object. So it doesn't bother them. Except if that, what they're seeing, the behavior is aggressive and scary, then it's going to scare them. Then they're going to recoil. They're going to be aggressive. So it depends on the nature of what they are seeing. I would like to share with you an experience I have. Once when my mother was hospitalized for her lung infection, when we went into a private ward, my mother started a private room. My mother starting to actually become very agitated and aggressive. She didn't say anything because at the time she was already not well. Her lung was quite infected. But she was staring at one point at the ceiling, and she was moving from left to right. Means she was moving and her eyes looked afraid, and she was very restless. She couldn't articulate what she had seen. And we always think that when the elderly visit hospital, right, that's what they normally do, because they don't like to stay in hospital, because the nurses like to come in and give them injection and all this, so they don't like it's an alien place and blah blah. So that's what I thought too. So I didn't think much of it until my teacher came to visit us, and she looked at my mom also had the same reaction. So she looked at my mom, and then after she told me quietly, because we are in Thailand. So in Thailand, in the hospital, in every single hospital, there is a Buddhist altar. They will install a Buddha statue, and I'm a Buddhist. So she told me that she will arrange to get the jasmine flower, to somebody to buy the flower, and she asked me to take the flower to offer to the Buddha, also stating what is my mother's full name and which room number she's staying, and to request for protection from the guardian beings there. So what I did is that when my teacher said that, I already felt that something is wrong, but fine, okay. Then after that, the next day I had the flowers sent to me, just a simple, very simple 10 baht kind of jasmine-like flower, which I will provide the image in this video. And then I went and do the offering. After that, the symptoms disappeared. Means there's no longer agitation or moving around. She was sleeping peacefully. So if it is a normal cause, then why did her symptoms get relieved through such a simple intervention? So this is why in hospital, because in hospital it's not surprising. Like that place which I'm staying, I already know that, even I personally know people who pass away in that private wing itself, because many people were admitted to hospital and they couldn't make it and they pass away. So of course hospitals are notorious for you know what. Now, when they come back, if we are taking care of them at home also, you also may notice that they are hallucinating. So don't think that it's your house haunted or whatever. These are beings that actually, what I'm going to say is something, again, as I have to give a disclaimer, is something that you may not heard about often. But these are beings that follow them. We will refer it as our karmic creditors, which I already done an earlier video explaining what is karmic creditors. I will link it in the description below. But karmic creditors, this is what they follow us. These are beings that we have karmic connection with. Usually is of not very wholesome nature. Like for example, beings that we have harmed, we've killed, or we have done wrong, and then they pass on, and then now they are coming to actually seek, they're coming to sabotage. In other words, I'm just going to be honest, is what is really happening. So when they come here, and you see, when a person have illness, their defense is down. That's when we know that, of course, when we are high and mighty and healthy and we are invincible, nothing can touch us. But then once the defenses go down, once the health goes down, that's when the problem comes. So I will share with you based on my own experience in dealing with this situation, and it is up to you whether you believe it or not. This is a topic I wanted to do for a long time already, but I just didn't find the time to really sit down and record the video. But I would like to share, because I'm getting what I'm reading in forums and support groups, the manifestation is as I say, in the West, it's much more worse. And what they're doing is that the only thing they can do is they can continue to increase the dosage and to manage the behavior and the symptoms. But what we do here is, as I said, my mom is also on medication to relax her mind and to enable her to sleep. I don't know whether you can hear a background. There's a very loud snoring voice in the next room. She's actually, the medication is still working, so she is actually resting. So she will snore like very loud, because for bedridden patients, right, what the doctor told me is that their tongue go down, so they will tend to snore very loud.